Hello, my name is Hannah Nico. I'm an intensive care nurse at UAMS, and today I'd like to take some time to teach you guys about the Glasgow Coma Scale. Um, First of all, I just want to let you know that I have provided a handout for you guys to follow along of my PowerPoint presentation. First of all, let's start off with talking about what exactly the Glasgow Coma Scale is. It's also known as the GCS. This is an assessment tool used by nurses all over. It's very universal to test for a patient's level of consciousness. It's just a way of nurses to be able to communicate with each other about what a patient's level of consciousness is. It provides data about the level of consciousness, but it should never be used as a complete neuroassessment. You still have to assess your patient. Basically, the score is based from 3 different categories. The first one would be eye response, the second being a verbal response, and then the third a motor response. And underneath each of these categories, it's broken down into different scoring processes that they can have. The best score that a patient can have would be a GCS of 15. This would be a normal GCS of patient, a normal level of consciousness. The lowest that a person can score is a 3. This being a very low functioning GCS level of consciousness. A score less than 7 is going to indicate that the patient is in a coma. Anything 7 and under. All right, so let's kind of break it down and discuss how to do the scoring. Eye-opening would be your first response. For a patient to score a 4, that would be a spontaneous eye-opening response. You would go in the patient's room, and if they're looking at you, then they would score a 4. A 3 would be verbal response. If you have to say something to them, or if you have to ask them to open their eyes, and they do so, the patient would get a 3. 2 would be if they only open their eyes when you inflict pain on them. Like if you go in to section a patient's ET tube and then they open their eyes, that would be a 2. 1 would be no response. No matter what you do or say to them or inflict any kind of pain on them and they don't open their eyes at all, they would score a 1. Next would be verbal response. If you go in the patient's room and they're awake and they're talking to you, they're completely oriented. They know where they are, what day it is, what year it is, and they're going to score a 5. For a 4, that would be your patient's confused. They don't know where they are. They make sense, but they just, they don't know exactly where they are, or they don't know what day it is. They can be awake. They're very confused. A 3 would be inappropriate words. They're kind of talking about things that don't make any sense, or words that just don't go along with what's going on. They would get a 3. A 2 would be an incomprehensible sound. They may be moaning, mumbling, can't make out what they're saying. That would have a patient score 2. A 1 would be no response. You go in, maybe they're intubated and unable to communicate with you. They would get a 1. Motor response, you have 6 choices for scoring under motor response. The first one would be you go in and they follow commands. That would be a 6. You ask them to squeeze your hand and they can do it. For a 5, that would mean a patient localizes pain. If you pinch their arm, they may go over with the other one, and that would imply that the patient knows where the pain is coming from. So they would get a 5. For a 4, for a patient to score 4, they're going to withdraw from painful stimuli. So if you pinch them over here, they're going to go away from the pain. They're going to withdraw. For a patient to score 3, they're going to do a decorticate posturing. This is an abnormal flexion. Basically what they're going to do is when you inflict pain, they're going to go in. Their arms are going to go in. And that's going to be a 3. For a patient to score 2, that's going to be abnormal extension. They're going to do decelerate posturing. That means their arms are going to go out like that, and their fists are going to go out. And they would get a 2. For a patient to get a 1 on the motor response, they're not going to have any response at all. So now that I've kind of taught you a little bit about how to do the scoring, let's go ahead and kind of do some together, some applications. So let's say you're an ER nurse and you get a patient come in with DKA. She's awake, she's alert, she's oriented, she's talking to you. You ask her to follow commands, and she can. What would we give her as a GCS score? Anybody know?
I would probably give her a 15.
A 15, right? Because she's completely with it and she wouldn't have any deficit. So we'd give her a level of consciousness of 15. That's right. Let's say that you're getting a report from a patient coming from an outside hospital transferring to your care, into your ICU. Upon report, you find out that this patient is intubated and sedated on a propofol drip. They tell you that he opens his eyes to painful stimuli. He's not following any commands. He's not able to communicate his needs. And whenever you inflict pain, he withdraws. So what would we give this patient for GCS?
I would probably give him a 7.
A 7, right. And that's another thing, too, about the Glasgow Coma Scale. It's a great way for nurses to communicate a patient's level of consciousness, like in reporting things. Because you can say this patient has a GCS of 7, and automatically the nurse, can break it down and know kind of what kind of patient they're getting. And I got one more for you. Let's say you get a patient in the ED and they're a motor vehicle accident that was intubated on the scene due to unresponsiveness. This patient obviously is unresponsive to verbal or tactile stimuli. And then you do a neuro assessment on her and you find out that she's doing deliberate posturing. So what would we give this patient?
Based off of my clinical assessment, I would probably have to give her a 4.
Right. This patient would get a 4. All right. So that's all I have for you guys today. I hope everybody can take something away from what I taught you, and I hope that everybody will be able to use the Glasgow Coma Scale now. Thank you for your time.